The European Union is fully committed to developing the universal healthcare system in the Philippines. Universal healthcare provides a safety net for families so that in case of illnesses, catastrophic illnesses also, they have a system that helps them to overcome that temporary difficulty. It also provides a financial support so people can avoid getting into debt traps, but they can, after the illness and they have recovered, they can contribute as normal citizens in the society. That support has been mainly in the form of budget support, which is funneled through the Treasury and through that to the Department of Health. And thereby, definition, it is fully compatible with the development goals of the Philippine government and the Department of Health. We have had excellent cooperation with the Department of Health through the decade. They have been very forthcoming and very understanding, and it has been a pleasure to work with them.
We appreciate the substantive support of the European Union to the Department of Health's mission to achieve universal healthcare. We look forward to strengthen our partnership with the EU in providing better health outcomes to all Filipinos, making them healthy and productive citizens as well.
With support from the Governor of Tarlac, the Dangerous Drug Board and the Department of Health, we developed treatment guidelines, trained staff and mandated the first voluntary medical methamphetamine treatment center in the Philippines.
We put up this center as an outpatient clinic for drug dependents and their families. It had got its certification from a DOH as an accredited a drug rehab facility. We had to execute a executive order, a resolution for the creation of this center. So when you do talk to them, why are they getting into drugs? Because they say this new form of drug, meth, would keep them up for long hours because they needed to work. But what kind of quality of life,
Nagjo-duty po ako kasi sa trabaho ko panggabi. Nagna-night duty po ako. Tsaka pinakamalaking influensya po sa akin kaya napasama po ako sa droga, yung sa barkada. Nayaya po ako ng barkada tapos isang bagay na kumbaga nagagamit ko po sa pag nagna-night duty ako.
Ang substance use disorder o yung addiction is a chronic relapsing illness. Sakit siya na paulit-ulit, although treatable siya.
We've imported a model called the Matrix model from UCLA. It was developed in the 1980s for cocaine, but it's a very good model for working with individuals who use shabu.
It's a medical treatment. It views drug use as a chronic relapsing disorder. It extends medical privacy and data confidentiality to drug use patients as we do for diabetes.
I would advocate for EU and other internationals to continue to support this initiative. It is viable as a community-based option, and most important, it is run by medical professionals who are accredited and licensed by the Department of Health.
When DOH started to work with the Tarlac Recovery Clinic, we were helped by partners. So dito yung pumasok yung EU, dito pumasok yung WHO, try to help us kung paano ba dapat yung standards na nilalagay dyan. So we looked into standards ng infrastructure, di ba? Yung design. So dapat may design siyang ganun. Tapos meron siyang mga manual of operations na dapat inaayos siya na dapat consistent yung operations ng guidelines starting from admission, pre-screening, until they go into a process of interventions, outpatient, until they are brought out and discharged.
Kasi ano ba yung gagawin mo pagka tinatamaan ka ng ganong pakiramdam? O kaya pag kahit yung lately po, yung paggalit ka, di ba? Ano bang ginagawa ng tao paggalit? Siyempre, pag may kaaway. Alcohol, kadalasan, minsan nasasamahan na ng yun yung may magre-relapse. Ibig sabihin, may pagkakataon kahit tinigil mo na, baka biglang ibalik mo kasi yun na yung mga trigger. Pero dahil doon sa alam mo na yung mga technique, mapiprevent mo yun.
What is good about this, it doesn't involve just the drug user or the drug dependent, but the entire family. We've had graduates already, our first batch of graduates, and they became our ambassadors in the different municipalities and towns. And they've seen that the program works. So now, for the second batch, we've had more enrollees coming in.
Kaya meron po akong dalawang kasama sa opisina na hinikayat ko po silang pumunta rito. Habang hindi pa po sila nararanasan yung mga naranasan namin, iwasan na po nilang gumamit.
From what has happened sa Tarlac, may mga interested that went with trying to say, hey, if Tarlac can do this, I think we can do this also. So the Department of Health has sat down and agreed that there will be about 6 recovery clinics that are ongoing. So meron nang dun sa Ifugao, sa Pasay, sa Calapan, Mindoro, Cebu, sa Davao, at sa Compostela Valley.
No one wants that drugs is prevalent in their communities. It destroys the very moral fiber of the community. What we want to push here is a rehabilitation of compassion. No? That the program not only deals with it, that there's some compassionate and a medical way of approaching the problem. We should not condemn. To me as a mother, every life counts. No? Every person should be given the chance to transform and lead a more productive life.